Okay, we're doing some microneedle therapy here. For the scalp, you only want to do 0.75 millimeter. If it's too short, too small, it won't penetrate deep enough. If it's longer, you will do damage. We don't want to go beyond the bulb. The microneedle creates thousands and thousands of tiny micro channels, which helps to absorb your hair loss treatments better. So you do not want to use harmful ingredients when you're using microneedle therapy. We're using titanium, and this is a much larger roller than we've used in the past. I think it's 1,200 needles, which makes it much easier. It's a much larger area. Now for this length hair, I would never roll this way. You're going to get tangled. So the trick here is not to get caught, is to part the hair, okay? And you want to roll little rolls, okay, over the scalp. So I normally count 1, 2, 3, 1, 2, 3, 1, 2, 3. You need to feel this, but it should not hurt. Okay, so if you can't feel it, then you're on too much hair or you're just not pressing hard enough. If you can feel it, then back off the pressure. So it is very, very individual. Section the width of the roller. You just saw me, I use a tail comb. Again, 1, 2, 3, 1, 2, 3, 1, 2, 3. Some people, if the hair is getting tangled, you're not using the right hair conditioner is the problem, or the right products for your particular hair. And we just keep sectioning. I do like nice clean sections for this. And here in the recessions, we want to make sure we're coming over and also on that hairline. Okay, 1, 2, 3, 1, 2, 3, 1, 2, 3. So this is probably the thing that takes the longest in the beginning, but once you get that little sort of routine, okay, you get a momentum and it's really nice and quick. Okay, what we want to work down is the side of the head. So I always start sort of on the right side, then I would go to the left side, and then I would move to the back of the head. And we just work our way down the head, and we're still feeling it, making sure we get that hairline. And right here in this corner, it's very, very thin, so you can hold the whole lot up, and you just actually go up into the hairline. Okay, and you would just repeat exactly the same on the other side. This is never done every day, only every second day, or some people we might say 3 times a week. Never microneedle every day, because you need to allow those channels we've just created to naturally heal. Okay, now we're going to move to the back. Okay. So it's still doing our microneedle therapy just through the back. I would do a part line down to the bottom, and all we want to do is the same thing, 1, 2, 3, 1, 2, 3, holding the hair aside if you need to, and just work down. You can stop here because this nape is quite thin, so we can come up at the end and roll up. And we just use these little orange peel sections to move around. And again, you can feel where you've been. Most people at this point have also used the scalp tonic. So your scalp is cold, you can feel that the follicles are open, and this is just adding that next level of treatment. So you literally are doing it by feel. A lot of people don't need to sort of look specifically in the mirror to do this, and you just work your way around to meet up to where we ended at that side there. You see I'm using my tail comb. I'm picking up and putting it down. I find that much easier. And always with your microneedle, I pop it down onto a soft surface like a towel or something. And at the end, we're just going to hold the hair up, and we're just going to roll into that hairline, that nape. Okay, and then you would just repeat that on the other side.